Hi, I want to talk for a minute about why the breath training should be done separately from your Pilates session or your physical exercise, and why exercise does not train your breathing muscles. So, it's generally understood with training that to make a muscle get stronger or to make a muscle undergo adaptation, the muscle has to be worked harder than usual. And aerobic exercise is practiced usually within the comfort of the breathing muscles. What that means is that you're limited it by your strength of your breathing muscles. You will not actually be able to exercise harder than your breathing muscles can handle. So the 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 practicing physical exercise and just pushing yourself harder is not going to make your lungs take. It's not going to increase your lung volume, and it's not going to increase the strength of your diaphragm. Um, Basically, the respiratory muscles, in a very simple way, have inspiratory muscles and expiratory muscles. And the inspiratory muscles actually have to use more effort in the breathing process, in the respiratory process. And the exhalation muscles are actually more, they're a little easier, and they're dictated more by the elasticity of the muscles. So, what you have to do in the training is you have to train your diaphragm. And we do that in the oxygen advantage and the breath holding exercises by simulating high altitude training. High altitude training is adding that extra load to the respiratory muscles, and it's actually improving the muscle strength. And it's basically targeting the diaphragm. So, holding the breath after a very passive exhalation, creating a strong shortage for air, is causing a disturbance to your blood acid base balance. So, your pH is changing, and the breath hold builds up excessive carbon dioxide that cannot leave the blood through the lungs because you're holding your breath. And the oxygen continues to be extracted by the cells of your body. So the combination of the carbon dioxide increasing, the hypercapnia, and the decrease in blood oxygen saturation, the hypoxia, so hypercapnia and hypoxia from the breath hold, along with the sensation of the diaphragm being in discomfort, so those involuntary contractions of the diaphragm, that causes the respiratory center to send impulses to the breathing muscles to resume breathing in order to restore the blood gases to normal. And as the breath hold continues, the impulses to increase the intensity causes the diaphragm to contract repeatedly. And you will feel it when you do it. Your diaphragm is going to be contracting involuntarily. And that intensity and the contractions of the diaphragm, that is your diaphragm workout. So that is what you're doing. You're training your diaphragm muscle. And the diaphragm muscle has been studied and is proven to be the most important breathing muscle, and actually one of the most important spinal stabilizers. So that's why the breathing needs to be done separately if you want to create a change. And you can't just go do some high intensity exercise and expect your breathing to be better.